This is video 9 for chapter 1 in anatomy and physiology. And in this video, we're going to look at how we separate the abdomen in the abdominal pelvic cavity into different zones to help explain what is going on or to refer to different organs within those zones. So we're going to look at this diagram over here. And you have to remember that anytime when we describe something, it's based on the patient's perspective. So when we look at this diagram, we're looking at this as the left side, but it's actually the patient's right side. So here we have divided into 4 sections. These are going to be the right sections. These are going to be the left because they are the patient's perspective. So this is referred to as the 4 quadrants of the abdominal cavity. So up here we have the right upper quadrant, and down here we have the right lower quadrant. And the right lower quadrant is typically referred to a lot because the appendix usually resides right down here. So if somebody has right lower quadrant pain, typically that could be an appendix inflammation or rupture. Then we have the left upper quadrant and the left lower quadrant. So left upper, we have the stomach. Right upper, we have a lot of the liver and the gallbladder. So doctors use these to describe where pain might be located or where there might be an issue. But we also can divide it into 9 regions. And these are going to be right, left, and then we have a middle section. So I'm going to use R and L for right and left. So this top portion right here is called the right hypochondriac region. This one is the right lumbar region. And this lower one is the right iliac region. Well, we have right, we have left of each one of those. So left hypochondriac, left lumbar, and left iliac regions. The middle regions have names based on higher and lower. So this is called the epigastric region. It's really over or on top of the stomach, which is this right here. This is called the umbilical because we would have the belly button located in that one. And this is the hypogastric, so below the stomach. So different things that we find. The hypogastric contains the rectum and the bladder. The right iliac is going to probably contain the appendix. The gallbladder, epigastric. So if they refer to epigastric pain, that's what they're referring to, that region. So when a doctor is examining you and pressing on different parts of your abdomen, they're seeing if you have any pain in these regions. And then sometimes some of these pains are referred. So that means that you might feel tenderness in one area, but it's referred to another area. So they use this to help quantify or help determine where something might be wrong. And a lot of times when they're examining for appendicitis, they'll press on this area over here or in conjunction with this area. And it's not so much the pressing in, it's rebound tenderness. So whenever they let go and there's like a bounciness, that really hurts from what I've heard. So these are just different ways that you can separate out the different regions.